Just a nurse. That's what Dr. Pierce called her in the hallway outside room 12, his voice carrying the particular contempt reserved for people he'd decided were beneath him. Just a nurse trying to play doctor. He didn't know her name yet. Didn't know that Danielle Ross had held a man's heart in her hands while bullets traced patterns through the walls around her. Didn't know that the folded flag in her locker came from someone whose last breath she'd felt against her palms at 2 in the morning in a combat surgical team tent 8,000 miles from here. He saw a woman in scrubs who moved quietly through the ICU at Cedar Creek Medical in Raleigh, someone who kept her head down and let people like him talk. What Dr. Pierce didn't see was what happened when the world stopped watching. The ICU exhaled its familiar smell, antiseptic and something underneath it, something like copper and fear mixed with the recycled air that never quite felt like breathing. Danielle arrived for the 7 a.m. shift, badge already clipped to her pocket before she cleared the sliding doors, her movements efficient and nearly invisible. The fluorescent lights overhead cast everything in that flat white glow that made time feel suspended. She nodded at the nursing station without breaking stride. Janet, the charge nurse, nodded back. No words necessary. They'd worked together long enough to communicate in glances and pauses, the language of people who'd seen enough to understand that talking was sometimes a luxury. Her locker was in the back corner, 3rd row, dented aluminum that had absorbed the weight of 1,000 shift changes. She pulled it open and the smell hit her, the faint scent of laundry detergent mixed with something else, something like old paper and dust. The folded flag sat on the top shelf, precisely where she'd placed it 3 weeks ago. Blue and white, maybe 6 inches across when folded into that tight military triangle. Her hand reached for it without thinking, muscle memory that bypassed her conscious mind entirely. Her fingers traced the edge where the stitching held the corners together. 17 years she'd carried people's last moments. 17 years of standing very still while the world shattered around her. She didn't know how long she stood there. Long enough for her breath to settle. Long enough for the tremor in her left hand to fade back below the surface where nobody could see it. The shift briefing happened at 7:25 a.m. in the unit's small conference room. For ICU nurses, 2 residents, and Dr. Pierce standing at the head of the table like a man who'd never questioned his right to be there. Danielle sat in the back, listening to the rundown of overnight admissions. Room 8 was stable, post-op cardiac, expected discharge to step down in 2 days. Room 10 had spiked a fever at 3 a.m., cultures pending, antibiotics already running. Room 12. Pierce paused there, his jaw tightening almost imperceptibly. The medic from Bagram. Blast injury, compound fractures, significant pulmonary involvement. He's stable but fragile. If anything changes, call immediately. He said it like a threat. Danielle made a note on her clipboard. Room 12. She'd already known his number. She'd checked his admission paperwork at 6:16 a.m., before shift change, before anyone else was watching. By 8 a.m. she was at the bedside of her first patient, a 73-year-old woman 3 days post-op from an abdominal resection, and her hands moved with the kind of precision that made people uncomfortable. She checked the foresight, no signs of infiltration, and her fingers moved through the assessment like she was reading something written in the patient's skin itself. Pulse. Respiration. Pupil response. She adjusted the bed angle and checked the Foley catheter output, noting the color and clarity without writing anything down. Her hands knew. They'd always known. She'd learned medicine in places where textbooks didn't exist, where the only teacher was consequence and the only classroom was a room where people were dying and you either stopped it or you didn't. Dr. Pierce appeared at the bedside like he'd been waiting for her. He did that sometimes, appeared right at the moment she was performing some task, some routine assessment, as if he'd been timing it. His presence changed the air pressure in the room, made it heavier. Mrs. Chen's looking good, Danielle said, not looking up from the monitor. Vital stable, drainage minimal. She said it in the voice she used for Dr. Pierce, soft, deferential, the voice of someone who knew her place. The voice of someone who was just a nurse. Pierce nodded but didn't leave. He was watching her hands move across the patient's abdomen, palpating for distension, checking the surgical site with a gentleness that seemed to offend him somehow. "You know," he said, and his voice had that particular edge to it, the one he saved for her, "it's remarkable how many nurses think a little anatomy class makes them diagnosticians." He wasn't looking at her. He was looking at Mrs. Chen, at the machine beside the bed, at anything except Danielle's face. They see one abnormal finding and suddenly they're running the show. Very unprofessional. Danielle's hand stilled on Mrs. Chen's abdomen for exactly 1 heartbeat. Then she continued her assessment, fingers gentle, movements precise. She straightened the gown, checked the dressing one more time, and turned to the monitor to verify the readings she'd already memorized. "Everything's tracking well," she said quietly. "I'll have pharmacy check the antibiotic levels at noon." Pierce left without responding. He didn't need to. He'd said what he came to say. The morning moved through its ritual. Room 9 needed a dressing change. She did it with the kind of attention that turned routine wound care into something closer to surgery, every movement calculated to minimize contamination, every breath timed with her hands. Room 11 needed morning vitals and a medication reconciliation, and she sat with the patient's chart, cross-referencing the home medication list against the current orders, her eyes catching a discrepancy in the beta-blocker dosing that the computer had flagged but nobody else had noticed. She sent a message to the pharmacy and moved on. Room 12 was next. The young medic was still asleep when she entered, or at least his eyes were closed. His left leg was elevated in traction, the femur fractured in 2 places from the blast. His right side was wrapped in bandages, third-degree burns across his ribs and shoulder, managed now but still raw underneath the dressings. The ventilator beside his bed moved with its mechanical rhythm, a sound like the patient's own lungs were in another room somewhere. His name was Marcus Halloway according to the chart. According to the chart, he was a combat medic with the 160th SAW Night Stalkers, recovered from an IED blast in Logar Province, treated initially at Kandahar Airfield before being stabilized for transport stateside. According to the chart, he was 26 years old. Danielle paused at his bedside longer than she paused at other patients' bedsides. Her jaw tightened in a way that only happened when she thought nobody was looking. She checked his vitals mechanically, pulse, respiration, O2 sat at 94%, and then she stood very still, looking at his face. Young. He was so young. She'd been young once too, she supposed. Back before young had been replaced by something older, something that had learned to see things and still function. "You're going to be all right," she said quietly, so softly that even if he'd been awake he might not have heard her. "I've got you." It wasn't a promise. It was a statement of fact, delivered in a voice that sounded like it was coming from someone else entirely. She was checking his 4 lines, 22-gauge peripheral access, good placement, no signs of infiltration, when she felt the shift in the room's atmosphere. Dr. Pierce in the doorway. Always appearing, never arriving. She didn't look up. Her hands continued their work, checking the dressing site, verifying the medication running, noting the fluid balance like she was reading a language only she could understand. "Interesting case," Pierce said, and his tone was different now, something almost like curiosity, except curiosity requires the possibility of being wrong, and Pierce had decided a long time ago that he was incapable of error. Combat medical training, apparently. Not that it matters when you're blown up. He said it like he was making conversation. Danielle's hand stilled on the 4 line for just a moment. "He saved lives before his own was on the line," she said quietly. "That matters." The words came out before she decided whether to speak them. Not the deferential tone. Something else underneath it. Something that sounded almost like authority. Pierce's eye sharpened. "Nurses save lives too, I'm sure," he said, and the way he said it made it clear that he didn't believe this, that he found the very concept mildly amusing. Though in different ways, of course. Smaller ways. Danielle straightened from the bedside, her movements fluid and controlled, and her eyes met his for exactly long enough to make the point clear. "I'm going on my break," she said, and her voice had gone flat, the particular flatness of someone who had accommodated as much as they intended to accommodate. "Marcus needs to be rotated in 30 minutes. His left side is under pressure. She walked past Pierce without waiting for permission. Back down the hallway toward the locker room, her feet moving with the precise rhythm of someone who counted steps the way other people counted breaths. The folded flag was waiting where she'd left it. She pulled the locker open and let her hand rest on the shelf beside it, not touching the flag itself but near enough to feel its presence. Outside, somewhere in the distance, she heard the sound of a helicopter moving across the city, its rotors cutting the morning air into pieces. The sound made her shoulders tighten. Made her think of dust and heat and the feeling of someone dying in your arms because you were the only medic within 40 kilometers and sometimes the only medic wasn't enough. She had 17 minutes left on her break. She sat on the bench in front of the lockers, breathing in the recycled air of the break room, and waited for her hands to stop shaking. The tremor was small, barely visible, the kind of thing that most people would miss. But she saw it. She always saw it. And she knew what it meant, that underneath the soft voice and the deferred posture, underneath the woman in scrubs who kept her head down and let Dr. Pierce talk, there was something else entirely. Something that had been forged in a place where keeping your head down meant staying alive, where deference was a weapon, and where the quiet ones were usually the ones you needed to worry about. When she returned to the ICU, the shift had moved forward without her. Patient stable, medications running, machines humming their mechanical song. And in room 12, Marcus Holloway slept under the fluorescent lights, his body healing one breath at a time, unaware that he was being watched over by someone who understood exactly what it meant to almost die and then have to figure out how to live anyway. Dr. Pierce was waiting for the rounds. And that was when everything that came after began to take shape. Room 8. Morning rounds. The light came through the window in pale rectangles, and the patient, a 73-year-old man 3 days post-op from a valve replacement, lay quietly against white pillows while his daughter stood near the monitors, arms crossed, watching everything. Dr. Pierce's hand moved across the chart with the certainty of someone who had never questioned his own judgment. Danielle stood at the foot of the bed, reading over his shoulder without comment, the way a good nurse does, present but invisible, her eyes moving down the medication list. Metoprolol for heart rate control. Standard post-op. Then she saw it. Lisinopril. ACE inhibitor. Reasonable. But then her eyes caught the dosage line, and the small hairs on the back of her neck went rigid. 40 milligrams. Twice daily. She looked at the patient's chart. Creatinine was 1.8. Already elevated. Kidney function was marginal at best. 40 milligrams of lisinopril on a patient with declining renal function and on post-op day 3 meant acute kidney injury waiting to happen, the kind that could tip into sepsis, into multi-organ failure, into the kind of death that came quietly in the night while families slept in the waiting room. She leaned forward slightly. Her voice came out soft, respectful, the practiced tone of someone asking permission to speak. "Doctor, I wanted to check the lisinopril dose. At 40 milligrams with his creatinine at 1.8, I'm concerned about acute kidney injury progression." The silence in the room became a tangible thing. The daughter's arms uncrossed. The heart monitor kept its rhythm. Dr. Pierce's pen stopped moving. He didn't look at her. He finished his note. Then he turned, his face arranged in an expression of profound condescension, the kind of look that suggested she had just asked him to explain gravity using sock puppets. "Your concern has been noted," he said. Then he turned to the daughter, his voice shifting into the warmth reserved for family members and important people. "Your father's medications are carefully calculated by his cardiologist and his surgeon. Sometimes nurses see numbers and don't understand the clinical context. This is what happens when we let people overstep their training." He smiled. Paternal. Reassuring. "Your father is in excellent hands." The daughter nodded slowly, the kind of nod that meant she would believe the man with the credentials and the authority, not the woman in blue scrubs who stood there looking down at her shoes. Danielle said nothing. She turned her attention to the fall line, checking the rate, checking the site, her hand steady as surgical lasers even though something deep in her chest was vibrating like a tuning fork struck in a vacuum. She blinked once. A single tear escaped, not from sadness but from the pressure of 3 years of this, of swallowing, of being small, and she wiped it with the back of her hand while keeping her eyes on the monitor. When she looked up, Dr. Pierce was watching her with an expression of satisfied disgust. She met his gaze. "Held it," said quietly, so only he could hear, "I have a duty to prevent harm, doctor. That doesn't require your signature." His jaw tightened. But he said nothing. He left the room, and Danielle stood there with the patient and his daughter, checking vitals, making notes, existing in the space between two worlds, the submissive nurse the daughter believed she was seeing, and something else entirely. Something he had caught a glimpse of and couldn't name. The next morning, Danielle pushed through the break room door with her lunch in a paper bag. The room smelled like old coffee and the microwaved remains of someone's 2-day-old pasta. 3 nurses sat at the far table, Jen, Marcus, and the new grad whose name Danielle could never quite remember. She headed for the small table by the window, sat down, and opened her container of grilled chicken and rice. Jen stood first, gathering her things without meeting her eyes. Marcus followed. The new grad hesitated, then whispered something to Marcus as she left, her voice carrying the careful tone of people discussing someone's divorce or their drinking problem. "Pierce says she's unstable. Military background or something. Apparently she nearly got kicked out of Walter Reed for insubordination." Walter Reed. They had checked. Or Pierce had checked, had made calls, had rattled things loose. Danielle sat alone at the table, methodically raising her fork to her mouth, chewing, swallowing. Her hand did not tremble. It would not tremble. But somewhere in her chest, behind the ribs, something was changing. The careful architecture she had built, the submissive posture, the soft voice, the made-small version of herself, was beginning to feel less like strategy and more like a costume that didn't fit anymore. She finished her lunch in silence and threw the container away. By 2 in the afternoon, a white printout had appeared on the unit board in the main hallway. A formal written warning, laminated and posted where staff, families, and patients could all read it. The letters were perfectly typed, the message clear and devastating in its bureaucratic tone. Written warning: Nurse D. Ross, insubordination and practicing beyond scope of license. On date, nurse verbally challenged physician's treatment decisions in the presence of patient and family member. This behavior constitutes insubordination and represents a safety risk. Corrective action required. Dr. Pierce stood near the board when Danielle came around the corner. He was speaking with the unit supervisor, his hands in his pockets, the picture of casual authority. When he saw her, he didn't smile. He just watched. She read the warning once. Then again. Her eyes moved over each word, the deliberate language, the selective truth, the careful framing that made sound medical judgment look like emotional instability. Staff members slowed as they passed the board, reading, glancing at her, reading again. The woman with the quality control problem. The unstable one. The one who thought she was smarter than a doctor. Danielle took one measured breath. The kind of breath taught in combat medicine courses, in through the nose, out through the mouth, for counts each, the breath that steadies hands before incisions, before hard decisions, before the moment when everything depends on your nerve. She walked directly to Dr. Pierce. Close enough that only he would hear. Her voice came out soft, but something had shifted in it. The tone was still respectful, but underneath was something else. Something like the sound of metal sliding against metal. A knife being drawn from a sheath. You're terrified someone will notice you're not the best person in this room. His face flushed. The color rose from his neck in a visible wave, red and blotchy, and for a moment his mouth opened as if to respond. But she had already turned away, already walking, already moving back down the corridor with the kind of calm that comes from having already survived the worst and knowing that this humiliation, this bureaucratic warfare, this small man with a pen and a title, was nothing compared to what she had walked through in Bagram. Behind her, Dr. Pierce's hands clenched into fists. His face went from red to white. The unit supervisor looked at him with a question forming on her face, but he was already walking, already calculating, already moving to the next phase. He had tried the social approach, the public humiliation, the written warnings, the poisoned word of mouth. And she had not broken. She had not cried. She had not crumbled. Which meant he would have to escalate. He went directly to his office and closed the door. His hands shook slightly as he picked up the phone and dialed a number he had memorized 3 days ago, right after the medication error incident. The credentialing board director answered on the second ring. Pierce's voice was steady, measured, professional, a concerned colleague reporting a potential safety issue, nothing more. I wanted to flag a nurse on my unit who may have been prematurely returned to clinical duty after a military discharge. There's a pattern of insubordination and questionable clinical judgment. I think her background should be reviewed. He hung up and made a second call. Then a third. Each call was a door opening, a file being pulled, a question being asked in rooms where questions like that took on weight and consequence. But that wasn't the worst part. That wasn't even close to the worst part. Danielle was sitting at the nursing station at 11:56 p.m., 8 hours into her night shift, when the alarms began to scream. Room 12. The young medic. The one whose eyes held the kind of darkness that only came from seeing things that shouldn't be seen. His monitor was screaming a rhythm that spelled death, VFib, the ventricles quivering uselessly, the heart no longer a pump but a tremor, a death sentence written in jagged lines across the cardiac monitor. She moved toward the sound before the second alarm sounded. The crash cart was already rolling, she had grabbed it, was already running, her legs eating the distance down the hall with the economical power of someone whose muscle memory had been trained in places where hesitation meant body bags. The covering physician, a resident on his second month of ICU rotation, was already in the room, staring at the monitor with the expression of a man watching his career implode in real time. VFib, Danielle said. Not a question. A statement. She was already reaching for the defibrillator pads, but something in her chest was screaming a different instruction. The rhythm was wrong. The timeline was wrong. This was a young, healthy man, 24 years old, airway patent, lungs clear. VFib didn't just start in a patient like this without warning. There was something else. We need to shock, the resident said, his voice an octave higher than it should have been. Defibrillation, then epinephrine, then. Danielle was already looking at his chest. The rise and fall was too shallow. The perfusion was already compromised. Shock alone wouldn't work. Nothing would work unless she could find what was killing him from the inside. She grabbed the scalpel from the crash cart, a standard instrument, not ideal, but it would cut, and without speaking, without asking, without waiting for protocol or permission, she made the incision. Left anterior thoracotomy, the same cut used in military medicine when seconds decided whether a man went home or went into the ground. Her hands moved through the tissue with the precision of someone who had done this before, who had practiced on cadavers and then on living people in tents with indirect fire crackling outside. Rib spreaders. The instruments felt right in her hands, muscle memory speaking a language older than words. She cracked his ribs with a controlled motion and pushed her hand into his chest cavity. There. A pneumothorax. His left lung was collapsed, and the pressure had been building, crushing his heart. She could feel the heart quivering against her palm, the rhythm of a man 3 seconds from death. Her other hand was already moving, fingers working the collapsed lung, feeling for the tear, finding it, and then she was injecting the needle, 14-gauge angiocath needle, the click and hiss of air escaping, and the medic's heart surged against her hand like something waking up. The room was silent except for the monitors. The resident stared. One of the nurses, younger, newer, someone who would never forget this, stared. And then the monitors caught up with reality. The rhythm smoothed. The jagged lines became organized. The heart found its sinus rhythm and held it, steady and strong and alive. Danielle's hand was still in the medic's chest, still feeling the heartbeat, making sure it was real. She was covered in blood up to her forearm. Her scrubs were soaked. She didn't speak. She didn't explain. She just worked, controlling the bleed, assessing for other injuries, moving with the automatic competence of someone whose training had been measured in lives saved rather than certifications earned. "Where did you?" the resident started. "Close the spreaders," Danielle said. Not a request. A command. The voice had changed. The words had become sharp-edged. "Get me 0 Vicryl for the ribs. We need to close this now." Nobody moved for a moment. Then the nurses moved. The resident moved. And Danielle stood there with her hands inside a man's chest, keeping him alive through sheer force of will and muscle memory that had been trained into her across 1,000 hours in places where the Geneva Convention was a suggestion and the only rule that mattered was bringing your people home. But that wasn't the worst part either. The worst part was that Dr. Pierce saw the aftermath. He had been called by the resident, had arrived within minutes, and he saw the sutured thoracotomy. He read the operative notes. He spoke to the nurses who had witnessed what they could not explain. And when he looked at Danielle, covered in blood, still in the room with the medic, checking his vitals with the focused intensity of someone who had just pulled a life back from the edge, something crystallized in his expression. Not confusion anymore. Recognition. He knew what she was. Or at least he knew what she wasn't. He went to his office. He made 3 more calls. To the credentialing board again, this time with the operative report and the surgical procedure performed without attending supervision. To the hospital administrator, describing a safety violation, a scope violation, a potential criminal act. And to someone else, someone in a federal building, someone who pulled files marked with codes he didn't recognize, someone who would make a call and set something in motion that neither of them could have predicted. The dominoes were toppling now. And Danielle Ross, standing in her blood-soaked scrubs, holding the vitals of a man she had just saved, had no idea what was about to walk through those hospital doors. The alarm screamed at 2:11 a.m. Room 12. Danielle was 3 floors up, restocking the supply closet on the cardiac ward when the code blue crackled over the intercom. Not her assignment anymore. Not her patient. Not her problem. That's what the badge restriction meant. That's what the suspended access card meant. That's what the formal letter of termination pending investigation meant. She moved anyway. The stairwell was empty. Her boots echoed against the concrete, the same combat boots she'd worn in Helmand Province, the same ones that had carried her through 72 hours of holding a compromised position while rounds tore the dust around her. The laces were still gritty with Bagram sand from 3 months ago. Nobody at Cedar Creek Medical had noticed. Nobody asked questions about a nurse who moved like she'd seen things that most people only had nightmares about. The ICU doors hissed open. Chaos. The kind of organized chaos that only happens when someone young is dying and everybody knows it. The heart monitor was screaming flatline. A ventilator hissed rhythmically, useless now. The covering doctor, a resident named Morrison who'd been trained in a simulation lab and nowhere else, stood frozen beside the bed with his hands trembling at his sides. His mouth was opening and closing. No sound. No action. Danielle saw him first. The medic in room 12. Specialist Marcus Webb. 26 years old. 2 years with 3rd Battalion, 5th Marines, Dark Horse Company. The posting she'd vacated 6 months ago when command had gone dark with the assignment to Cedar Creek. He'd taken her place. He'd taken the mission she'd trained for. He'd taken the risks she would have carried. And now his chest wasn't moving except for the ventilator doing it for him. His skin had the grey-white pallor of someone whose blood pressure had already dropped past saving. The nurse nearest the bed, Jennifer, new to critical care, good instincts but no experience, was already moving for the crash cart. The attending hadn't arrived yet. This was going to be the minute where it mattered whether you froze or you moved. "Get the kit," Danielle said. Her voice didn't ask. It commanded. Morrison's head snapped toward her. The thoracotomy tray. Left-sided anterolateral approach. Now. You're not cleared to. Do it or watch him die. Danielle was already moving. Already peeling off her jacket. Already rolling up her sleeves to the elbows, the tattoo on her inner arm visible for the first time in 6 months, the unit insignia of 5th Marines, the date of Bagram, coordinates that nobody at Cedar Creek would recognize. She snapped on gloves. The sound was like gunshots in the suddenly quiet room. Everyone had stopped moving. Everyone was watching. The scalpel came out of the tray Jennifer brought. Danielle didn't pick up the standard surgical blade. She reached for the trauma shears with the call sign engraved on the handle, Ghost, the name she'd earned when she'd held that position alone, invisible in the dust, for 3 days while the world forgot she existed. Her hands weren't trembling. Her hands were steady as surgical lasers. Her hands had done this before. Not in a hospital. Not with monitors and backup. In the field. In the dark. With nothing but muscle memory and the absolute certainty that if she didn't move, someone would die. The blade went in through the 5th intercostal space. The hiss of air escaping from the collapsed lung was loud. Danielle was already moving. Already positioning. Already reaching in with fingers that knew exactly what they were looking for, the pulmonary artery clamped and torn by shrapnel or blunt force, probably impact from his transport. The medic had been injured in transit, the file said. Mechanism unclear. That was code for classified extraction gone wrong. Her fingers found the heart. Stopped. Dead in her hand. No pump. No rhythm. Just a stone. She began the manual massage. Gentle at first, then harder. Rhythmic. The way she'd learned it from a Navy SEAL instructor in a swimming pool in San Diego, practicing on a waterlogged dummy until the motion became unconscious. Until trauma became routine. Until death became something you simply refused to accept. 1 compression. 2. The monitors were still flat line. 3. 4. 5. Nobody was breathing in this room except the ventilator. The attending had arrived now, standing in the doorway, mouth open. The other nurses were staring like they were watching someone commit murder in real time. Epi, Danielle said. Her voice was different now. Deeper. The voice of someone who'd given orders to people carrying weapons. 1 milligram for push. Now. Jennifer jabbed the needle in. Danielle felt the medication wash through the bloodstream, a phantom sensation she shouldn't have been able to feel but always did. The heart under her fingers stayed stone. 6 compressions. 7. 8. 9. She was counting without meaning to. She was moving without thinking. She was someone else entirely. The monitor blinked. Just once. A single spike. Then flat line again. Again, Danielle said. Push another epi. Another needle. Another dose. Another minute of compressions that felt like hours because time does something strange when you're trying to resurrect the dead. The fluorescent lights overhead buzzed in a way that suddenly sounded like helicopter rotors. Her peripheral vision tunneled. The world narrowed to the size of this chest cavity and the stone-cold organ in her palm. The monitor blinked again. This time it held. A rhythm. Chaotic at first, ventricular fibrillation, wild and desperate, but a rhythm. A heartbeat. The heart under her fingers responded, pushing back against her palm, insisting on living. 75 beats per minute. 80. 85. The color was already coming back to Webb's face. Pink. Living. Breathing. His eyes opened for a fraction of a second. Just long enough for them to meet hers. Just long enough for recognition to flicker across his features like lightning. He'd seen those eyes before. 3 months ago, in a different uniform, across a briefing table. Ghost. The operative who'd held their position. The one who'd gone dark for a classified assignment. His lips moved. No sound came out. Then he was under again, the sedation and the shock pulling him back down into unconsciousness, but she'd seen it. He knew. He knew what she was. The attending finally moved. "Step back," he said to Danielle. His voice was shaking. "Step back now." Danielle stepped back. Her gloves were bloody. Her scrubs were bloody. Her hands were still moving with muscle memory, fingers still remembering the shape of a human heart, still feeling the pulse of a man who should have been dead but wasn't. Not her patient anymore. Not her responsibility. But alive. That was the part that mattered. That was the part that was going to cost her everything. Pierce arrived 7 minutes later. He stood in the ICU doorway, still in yesterday's clothes, looking like he'd been called from home. His eyes moved across the scene with surgical precision. The crash cart. The blood on the floor. The thoracotomy tray with the trauma shears, the ones with ghost engraved on the handle, sitting right there in plain sight for anyone with eyes to read. His gaze locked on Danielle's. She was standing still. Her composure was absolute. Her face was a mask. But her hands were trembling, and not from fear. From restraint. "Everyone out," Pierce said quietly. Everyone except Captain Ross. The attending froze. Nobody moved. The word hung in the air like a bullet that had already been fired, and nobody had noticed the gunshot until they felt the impact. "Captain." He'd said captain. He was looking at the trauma shears. He was looking at her blood-stained scrubs. He was looking at a young military operative who'd just been brought back from the edge of death by someone who knew exactly how to do it. The doors closed. The ICU staff shuffled out, confused, uncertain, leaving her alone with Pierce and the body of Marcus Webb, still bleeding and breathing and alive because of something she'd done. "My phone," Pierce said, pulling it from his pocket, "is about to ring with a call from the credentialing board. And then another from hospital administration. And then, I imagine, from someone with far more authority than both of us combined. So before we go through the performance of explaining this, why don't you tell me exactly who you are?" Danielle didn't answer. She was looking at Webb's monitor. Sinus rhythm. Perfect. Steady. The kind of heartbeat that comes from someone who's supposed to be dead and somehow isn't. The kind of outcome that only happens when the person saving you is trained for it. Trained for exactly it. Her phone buzzed. A text from Cedar Creek Administration, termination hearing scheduled. Effective immediately, pending investigation. But that wasn't the worst part. The worst part was that her cover was about to walk through a hospital door in the uniform of the United States Marine Corps, and when they saw Marcus Webb alive, a man who should have been pronounced dead in transport, they were going to ask questions that she couldn't answer without burning every operative still embedded in the Middle East. The worst part was that her daughter was asleep at home, waiting for a mother who was about to disappear again. The schedule rotation arrived via email at 6:53 a.m. Danielle read it once, then again, her eyes tracking the reassignment with the precision of someone reading a medical chart. 3 critical care patients removed. Supply inventory, Tuesday through Thursday. Equipment maintenance, Friday. Administrative data entry, Wednesday afternoons. The cuts were surgical, not obvious enough to trigger HR scrutiny, just competent enough to bury her where she couldn't save lives. She'd seen this pattern before. Different country, different stakes, same tactical isolation. Dr. Pierce had moved beyond public humiliation. He was now operating at the level of institutional sabotage, and it was working. By noon, the hospital credentialing board had received a formal report citing her emergency thoracotomy as evidence of practicing beyond scope of licensure. The medication correction incident was documented as insubordination. The language was precise, professional, damning. A copy had been printed and posted in the break room, another public blade, this one with institutional weight. Danielle sat in the ICU break room, coffee untouched, watching staff avert their eyes as they passed. The fluorescent lights hummed their mechanical lament. Nobody spoke to her. Nobody needed to. The report had done the speaking. Her phone buzzed. A text from her commanding officer, a man whose name she couldn't speak aloud, maintain position 48 hours. Asset arriving tonight under Marine escort. Situation will resolve. Do not communicate. She understood. The Taliban commander was coming. Her cover was about to collapse. And she couldn't defend herself without burning every operative still embedded downrange, 12 men and women whose lives depended on her silence. The weight of it pressed down like armor. By 4 p.m., her locker was open. She'd started removing personal items methodically, a photograph of her daughter at summer camp, a spare pair of trauma shears, the small folded flag from Marcus's deployment, the one his squad had carried through his final operation. It smelled like gun oil and desert dust. She held it without shaking, without letting her hands betray anything, though her vision blurred at the edges. The shouting began at 4:43 p.m. It started as a commotion near the ICU entrance, raised voices, the sound of equipment clattering. Danielle turned, already moving. A stretcher was being rushed through the double doors, flanked by 2 Marines in full tactical gear, M4 carbines slung across their chests. Between them was a patient, restrained, massive, 6'5", probably 250 pounds, muscles corded like steel cable beneath brown skin. His eyes were wild, pupils dilated, his breathing ragged. Blood soaked the right side of his abdomen where a field dressing had started to fail. The emergency room staff scattered like startled birds. A nurse dropped her clipboard. Another backed away, pressing herself against the wall. Dr. Pierce froze for exactly 2 seconds, then turned and walked directly into a supply closet, locking the door behind him with a soft click. The Taliban commander's restraint suddenly gave way, a leather strap tore free from the gurney. He lurched upward, roaring something in Pashto that translated to pure rage, his voice filling the ICU like thunder. Equipment flew. A cardiac monitor crashed to the floor, its screen shattering. The Marines moved to contain him, but civilians were in every line of sight, and one wrong move meant a ricochet through a patient's chest. Everyone ran. Nurses scattered toward supply rooms. A resident ducked behind a computer station. The ICU became a storm of fleeing bodies and the terrible sound of a man in agony, violent and incoherent, blood streaming down his side where the field dressing had torn completely free. Danielle walked toward him. She moved between the chaos with the kind of calm that comes from having already survived worse. Her hands were visible, empty, and her voice, when she spoke, was the color of slate. "You're going to bleed out in 90 seconds if you don't let me help you." The commander swung at her. His arm came up like a tree branch falling, slow and powerful and inevitable. She sidestepped with combat precision, not a nurse's hesitant dodge, but a soldier's movement, her body reading his trajectory before his brain had finished calculating the swing. She caught his wrist, felt the power in him, the wounded animal fury, and redirected his momentum in one fluid motion. He crashed onto the nearest gurney, the fall controlled, her hands cushioning his impact against the metal rails. She was already applying pressure to his wound before he finished settling. "I need 14-gauge angiocath, 500 cubic centimeters bolus of normal saline, and someone to grab a second set of hands," she said, her voice level. "Now." A young nurse emerged from behind a station, hesitated, then moved. "I'm here." The commander's eyes focused slowly. Recognition flared across his face like a struck match. He stared at her, through the pain, through the rage, and his voice dropped to a whisper that carried across the sudden silence, "Shaitan al-Sara." The desert ghost. One of the Marines went rigid. He pulled his phone from his tactical vest, typed with trembling fingers, then looked up at Danielle with something between shock and reverence. Dr. Pierce emerged from the supply closet, his face flushed with fury. "Get away from him. You're suspended." "Security." His voice climbed. "I said security." The Marine was reading from his phone now, his voice filling the ICU with words that changed everything. "Captain Danielle Ross, United States Army Special Forces Medical Sergeant, Silver Star recipient." Citation reads, "For actions under fire in Bagram where she held a compromised forward operating position for 72 hours under sustained enemy attack, providing emergency combat casualty care while coordinating air support assets." The second Marine came to attention, his boots clicking on the tile floor. I served with your unit. Second deployment. You trained half-hour medics. A trauma surgeon, Dr. Khalil, who'd been hiding behind the nurse's station, stepped forward slowly, recognition dawning across his face like a sunrise. Ross. You're the one who wrote the field thoracotomy protocol. I've been teaching it to residents for 5 years without knowing your name was the signature on it. Danielle didn't look up from the Taliban commander's wound. She was assessing the bleeding pattern, the pallor of his skin, the fragile border between stable vitals and cardiac arrest. Her hands moved like they belonged to a different person, not a nurse following protocols, but a surgeon responding to trauma the way a pianist responds to a Chopin nocturne. The tissue damage was extensive. She'd seen worse. She'd survived worse. The patient needs surgery in the next 20 minutes, she said quietly. Vascular team and general surgery. Type and cross for 6 units. Dr. Pierce pushed forward, his voice rising. This is absurd. She's a nurse. I demand. The IT director appeared, a man named Clayton who'd served 8 years in the Navy before taking an office job. He held a tablet, and his expression was the cold calm of someone holding an evisceration waiting to happen. Doctor, we need to talk about the hallway footage you've been trying to delete for the past hour. I've saved every frame. Every conversation about this nurse. Every fabricated report. Every call to the credentialing board. The hospital administrator, a woman named Patricia who'd worked at Cedar Creek for 19 years, took the tablet from Clayton's hands. She looked at the footage, at Pierce's face, at Danielle kneeling beside a bleeding prisoner while applying field medicine that would keep him breathing, and made a decision that took exactly 4 seconds. Dr. Pierce, you're suspended pending investigation. Effective immediately. Pierce's face went the color of old concrete. You don't understand what she is. She's a captain in United States Army Special Forces who just saved a prisoner's life instead of letting him die, Patricia said, her voice level. Security, please escort Dr. Pierce from the building. 2 hospital security officers appeared, moving with the professional courtesy that conceals absolute firmness. Pierce didn't resist. He looked too shocked to do anything but follow them toward the exit. Danielle finally looked up from the Taliban commander's abdomen. Her eyes met the first Marines, just for a fraction of a second. Recognition, acknowledgement, the terrible understanding between soldiers who'd buried people together. Just Danielle, she said quietly. And I'm still a nurse. The commander, sedated now, his vitals stabilizing, muttered something in Pashto. The Marine who spoke the language leaned close, listened, then his eyes widened. He looked at Danielle with something that might have been awe. He says, the Marine translated slowly, that the ghost who walks toward death saved him twice now. Danielle washed her hands 20 minutes later, standing alone at the sink in the staff locker room. Blood swirled down the drain in pink ribbons. Her reflection stared back at her from the mirror, exhausted, bleeding from a cut on her knuckle she hadn't noticed, still wearing the blood-soaked scrubs of a soldier doing a nurse's job. The folded flag from Marcus's deployment sat on the bench behind her, waiting. Her daughter was at home, waiting. 2 separate futures, neither of them certain, both of them reaching for her across an impossible distance. She dried her hands on a paper towel and listened to the sirens in the distance, not approaching, but already inside the building, surrounding her, containing her in a moment where everything she'd hidden was suddenly visible and nothing could ever be hidden again. 3 days of silence. That's how long the suspension lasted before everything changed. Danielle had moved through her apartment like a ghost, making breakfast for her daughter, helping with homework, pretending that the weight crushing her chest was something she could breathe through. The folded flag sat on her kitchen table, the one from Davies, the medic who'd taken her posting in Bagram. She couldn't look at it without feeling her hands shake, so she kept her hands moving. Cleaning. Organizing. Anything but still. The medical board hearing was scheduled for November. The state investigation would take months. In the meantime, she was nobody again. Just a nurse who'd overstepped. Just a woman who'd made a scene. Just a fabrication Dr. Pierce had decided to dismantle. The call came at 2:13 a.m. from Cedar Creek Medical's night charge nurse. "We need you. Now." It wasn't a request. It wasn't even a question. It was the tone of someone who'd seen the security footage, who knew exactly what Danielle had done to Marcus Webb, who understood that some people didn't need a credential to save a life, they just needed permission to try. She told her sleeping daughter she was going in early, left a note on the refrigerator, and drove through the pre-dawn darkness to the hospital that had decided to destroy her. The parking lot was nearly empty. The ER entrance was cordoned off with security tape. Police cars sat at odd angles near the trauma bay. Something had happened. Something bad enough to override protocol, to call back the nurse they'd fired, to send out an emergency message to the only person in the building who knew how to think when the world was ending. She didn't ask questions. She moved through the corridors with the muscle memory of someone who'd walked these halls for 11 months, her hand moving instinctively to her ID badge before remembering it no longer worked. A security guard saw her coming and simply opened the ICU doors without checking. They all knew. Everyone in Cedar Creek Medical knew by now what she was, what she'd done, what she could do. The knowledge had spread through the hospital like electricity through water. The Taliban commander lay in ICU Bay 3 under armed guard, a man with a massive head wound, bleeding from a compromised carotid artery, the left side of his face already swelling into that mottled purple that meant infection had begun setting in hours before arrival. 2 Marines flanked his bed, both with their hands resting on their sidearms, both watching the door with the kind of tactical focus that came from understanding exactly how much danger they were standing in. The prisoner's eyes moved toward Danielle as she entered the bay, and something shifted in his expression. Recognition. Absolute, instantaneous recognition. He whispered a single word. 2 syllables. A name that had belonged to her for 72 hours in a collapsed building in Bagram while she held a position that wasn't supposed to hold, while she kept 17 operatives alive through the kind of fire that melted rifle barrels and turned concrete walls into shrapnel. Shaitan al-Sa'ar, he breathed, loud enough for the Marine escort to hear. The desert ghost. The one who walks toward the fire. The Marine's hand went rigid on his sidearm. His eyes went to his phone. His thumb moved. 30 seconds later, he was reading aloud from a military database that should never have been accessible from a hospital ICU, but his security clearance was high enough to pierce almost anything. His voice was steady, official, the cadence of someone speaking facts that would change everything. Captain Danielle Ross, United States Army Special Forces Medical Sergeant. Silver Star recipient for actions under fire in Bagram where she held a compromised position for 72 hours under sustained enemy contact. Code name, Shaitan al-Sa'ar. Current assignment, classified. He lowered the phone. His eyes found hers. Your medical license suspension is rescinded as of this moment. You're operating under federal authority now. He paused. Welcome back, Captain. The cardiac monitor beeped its steady rhythm. The ventilator wheezed its mechanical breath. And then the door burst open. Dr. Pierce stood in the frame like a man whose empire was collapsing in real time, his face the color of old concrete, his eyes moving from the Marines to Danielle to the prisoner and back again. His mouth opened. He was going to speak, going to demand, to dismiss, to reassert whatever authority he still believed he possessed. He stepped into the ICU. He raised his hand. He was going to order everyone out of the bay, going to reclaim control, going to pretend he had any power left in this room or any room in Cedar Creek Medical ever again. That's when the IT director appeared in the doorway behind him, a compact man with a Navy tattoo on his forearm and the kind of expression that came from having spent 12 years in signals intelligence before moving to civilian work. He was holding a laptop. His voice cut across the ICU like a blade. Dr. Pierce, I flag 847 gigabytes of hallway security footage showing systematic harassment, schedule manipulation, and deliberate character assassination. Every conversation. Every whisper. Every moment you told staff members lies about this nurse's stability, her competence, her fitness to practice. The IT director stepped forward. I forwarded all of it to the hospital board. the State Medical Board, and the FBI. The deletion logs on your computer show you attempted to erase footage 23 times. You failed. I recovered every file. He held up the laptop. Your internet search history includes 3 separate queries about how to fake medical evidence and how to pressure a licensing board. It's all documented. It's all admissible. And you're finished. The room went so quiet you could hear the rain outside beginning to fall against the windows. Dr. Pierce's face underwent a transformation that took maybe 3 seconds total, from arrogance to shock to something worse, something that looked like understanding. His mouth worked soundlessly. He took a step backward. Then another. His hands came up in a gesture that might have been surrender or might have been prayer. The Marines didn't move. Danielle didn't move. The IT director simply waited, holding that laptop like he was holding a sword with Dr. Pierce's name written on the blade. "You're suspended pending investigation," the IT director said quietly. "And you're never practicing medicine in this state again." What happened next unfolded like a legal symphony. Over the following weeks, the investigation expanded into something that resembled a military tribunal more than a civilian credentialing review. The IT director's footage showed Pierce whispering poisoned words to nursing staff in supply closets. The security recordings captured him altering Danielle's schedule by hand, making notations in margins that showed he'd deliberately removed her from cases where her expertise would have been visible to attending physicians. His personal phone records, obtained through a warrant that came with surprising speed, showed calls to 2 hospital administrators, both of whom admitted he'd pressured them to rubber stamp his termination request without due process. The medication error Danielle had caught came under review. 3 separate pharmacists confirmed that Pierce's original order would have caused cardiac arrhythmias in a pediatric patient. Fatal arrhythmias. She'd stopped a death, and he'd tried to destroy her for it. The State Medical Board convened a hearing. Pierce's attorney argued patient safety. The Independent Surgical Review Board examined the field thoracotomy performed on Marcus Webb, the medic in room 12 who'd coded during shift change. The 3 surgeons conducting the review, one from Duke, one from Johns Hopkins, one from Bethesda Naval Hospital, submitted a single-page consensus. The procedure was executed with textbook precision by someone demonstrating advanced combat surgical training and steady hands under extreme duress. The operative choices were correct. The patient survived because of this intervention. This constitutes exemplary emergency medicine. They recommended a commendation, not an investigation. They recommended that whoever performed this procedure should be teaching other physicians, not being destroyed by them. 6 months after the suspension, after the hearing, after the appeals process ran its course like a train nobody could stop, someone spotted Dr. Pierce driving a white medical supply van for a rural clinic network in eastern North Carolina. His medical license was suspended indefinitely. His hospital privileges were revoked. His wife had left him in November, taking their 2 children and filing for sole custody. The house went into foreclosure. His attorney's office closed. He became the cautionary tale that whispered through the medical community in Raleigh, the doctor who'd tried to destroy a nurse and had instead destroyed himself by trying too hard, by pushing too far, by underestimating exactly what kind of person he was standing next to. None of this mattered to Danielle. Or rather, it mattered in the way that a completed mission matters, as something finished, archived, processed. What mattered was that she walked back into Cedar Creek Medical in her scrubs on the first Monday of December, her credentials restored, her name cleared, her presence in the ICU now accompanied by a knowledge that moved through the hospital like light through water. The medic in room 12 of Marcus Webb, Captain, United States Army Special Forces, sat up in bed when she entered the bay. His chest was still wrapped, the incision healing with the kind of pink that meant healthy new tissue was forming beneath the surface. She'd saved his life by cracking his ribs, by reaching into his chest with hands that had learned this violence in a place where violence was the only language left. He saluted her from the bed. A full, formal military salute. She saluted back, and something cracked open in her chest that she'd kept sealed for 11 months. Tears. Actual tears. The first one she'd allowed herself since she watched Davies die in the building in Bagram. Her daughter came to the hospital the following Saturday. The child stood in the doorway of the ICU watching her mother move between patients, wearing scrubs but also, for the first time, wearing the kind of authority that had nothing to do with a title. Danielle knelt down to her daughter's eye level. The girl was looking at her the way children look at people they thought they knew but suddenly realized they'd never really seen. "You're different here," her daughter said. Danielle smiled. "I'm myself here, baby. Everywhere else, I was pretending to be smaller than I am." She took her daughter's hand and walked her through the ward, introducing her to the nurses, the respiratory therapists, the attending physicians. Everyone was different around Danielle now. Everyone straightened. Everyone paid attention. Everyone treated her like what she actually was. The break room was the last stop. The place where staff had risen and left when she sat down, poisoned by Pierce's whispered warnings about her instability. Now she walked in and the room simply stood, not in fear, but in something that resembled respect. The RN who'd abandoned her in October moved toward her and simply said, "I'm sorry." Danielle nodded. She wasn't angry. Anger was something she'd learned to put away in Bagram. She was just present. Just exactly what she was. Just a nurse who'd walked toward danger while everyone else ran, and who would do it again tomorrow if that's what the patients needed. The folded flag from Davies sat in a shadow box on the wall now. Danielle had donated it to Cedar Creek Medical, a permanent fixture in the break room. Beneath it, a small brass plaque read, "Captain Danielle Ross, RN, Special Forces Medic, some heroes hide in plain sight. If you've made it this far, you've seen what heroism actually looks like. Not the kind that makes the news. Not the kind that gets medals pinned on in public ceremonies. The kind that shows up to work in scrubs when everything's trying to destroy you, and saves another person's life because that's the job. If you've ever underestimated someone, a nurse, a janitor, a person you thought was smaller than they actually were, comment below and tell me about the moment you realized you were wrong. Subscribe and share this story with someone who needs to remember that true heroism is what you do when the world stops watching. Share Captain Ross's story. Because there are people like her everywhere, walking toward the fire while the rest of us run, and they deserve to be seen.